sometimes nowadays it's very common that pyrexia is there, lacrimation with the skin nodules, lymphedema with or without skin nodules, brisket edema. Many number of cases are being noticed in the field conditions. It's nothing but lumpy skin disease. So let's see about a short about lumpy skin disease of various clinical signs alone. So it is a viral disease. Nowadays we are seeing many number of cases in the field conditions everywhere, and it is caused by it's a poxviridae genus Capripox virus, and it's a sheeppox and goatpox virus are the other two virus species in this genus. It's similar to sheeppox and goatpox virus. It's mainly transmitted by vector-borne. So it's a transmission by biting insects. Vector-borne transmission is appreciable, and direct contact is considered to a major, not a major role. It's a minor role in the transmission, especially the transmission is by vector-borne. And the main thing is a stable fly. The transmission by the stable fly and mosquitoes, culex and Aedes, and also transmitted by ticks, Rhipicephalus, appendiculatus, and ambulum. So these all the vectors play important role in the transmission of lumpy skin disease, and all age groups and type of cattle are susceptible for this lumpy skin. So there is no thing like young one or adult like that. All age groups are affected, and animals recently recovered from an attack have a solid immunity for 3 months. And very young calves, lactating and malnourished cattle or debilitated cattle or very young calves are more susceptible for severe clinical signs. You could have come across in the field conditions like many number of calves which are having severe skin lesions, debilitated calf, not dewormed calf, malnourished calf. They will be exhibiting more severe type of clinical cases, clinical manifestations. And LSD is not a zoonotic, and the source of the virus is appreciable in the skin nodules. The source of the virus is most appreciable in the skin nodules, in the scab and the crust, and it will be available for more than 35 days. The virus will be available in the skin nodules and the crust or the scab for more than 35 days. So the virus can be isolated from the blood, saliva, ocular or nasal discharge and the semen. Okay. So LSD is found in the blood is a viremia for 7 to 21 days post infection, and at the lower levels than it present in the skin nodules. So that the skin nodules is the virus will be present in the skin nodules, and it is a preferable sample for diagnosis and for getting the diagnosis. So the pathogenesis, the virus transmitted mechanically by biting insects, and immediately it will get rapidly dissemination the leukocyte associated viremia developed, and it will develop into the vasculitis and thrombosis, infarction, edema, and inflammatory cell infiltration, and in the forming of skin nodules. So because of this type of pathogenesis only, we are getting many number of cases because of lymphadenopathy. We are getting many number of cases with lymphedema. So there won't be any lesions, skin lesions won't be there in some other cases. All other cases, only lymphedema will be there. Only lymphedema alone will be there. Sometimes brisket edema alone will be there. All these times we have to differentiate from lumpy skin disease from other clinical conditions. Nowadays we are getting many number of cases with the brisket edema alone. We have to differentiate from pericarditis. So in pericarditis we will be getting jugular vein engorgement, bilateral jugular vein engorgement, positive venous stasis will be there. Here everything will be negative. Only brisket edema alone will be noticed. Lymph node enlargement will be noticed. So you think about that. So we have seen many number of cases without skin lesions, only edema alone also. That is also lumpy skin disease. So here the incubation period is about 2 to 4 weeks, and the first animal will be exhibiting temperature, followed by lacrimation, severe rhinitis and conjunctivitis, and the enlargement of the superficial lymph nodes, and then appreciating the skin nodules all over the body region. And see in this picture, we can able to appreciate the enlargement of the skin lymph node. So prescapular lymph node will be enlarged. Sometimes prefemoral, precrural lymph node is also very much enlarged. Mucous membrane will be normal or congested. Suppose when there is enlarged lymph node with the pale mucous membrane, petechial hemorrhages, you will be thinking about theileriosis. So like that, you have to differentiate the other clinical conditions. So here the lacrimation, bilateral or unilateral lacrimation are noticed. And the cutaneous nodules are Small nodules are noticed at 2 to 5 centimeters in diameter, noticed all over the body region. So we'll be seeing not only a particular area like in head, neck, limbs like that, it is appreciable all over the body region. Immediately after the onset of febrile reaction, after 48 hours, the cutaneous nodules developed all over the body region. So this type of lesions are appreciable in some cases, and this is used to call as sit fast. Large nodules become necrotic in nature, and fibrotic and necrotic in nature, and it will be persistent for months. So even after the healing process, it will persist for months. It's called sit fast. The scars remains sometimes for a long period, and sometimes the limbs and other ventral part of the body also will be noticed. Edema will be noticed in the ventral region, ventral edema, perineal edema, limb edema, brisket edema. Sometimes in the scrotum and vulval edema also noticed in some cases. See here, large and small nodules are present all over the body region. Large and small nodules. See here, you have to differentiate from urticaria. Urticaria is the superficial skin lesions. Here, the skin nodules are there. It is a raised nodules. Sometimes it may be getting peeled off. See this type of generalized nodules are noticed all over the body region. So all the forelimbs, hind limbs, and throughout the body it is distributed. And lesions are noticed in the oral cavity. Oral lesions are noticed. Sometimes lesions are noticed in the muscle region also. These are the healed lesions noticed in the muscle, and nodular lesions all over the body region. So you can palpate the nodule and you can see it's very much obvious. See here also the lesions are noticed in the around the eyes, and the brisket edema is noticed. See here, brisket edema is noticed, very much obvious. So you have to differentiate. So there is no, in this case, there is no other skin lesions. Skin lesions is not there, but only brisket edema and lymph node enlargement is there. So you have to differentiate from the other conditions. See, brisket edema with lymph node enlargement. It's a clear case of lumpy skin disease. See, in some cases, the skin nodules won't be obvious. You cannot, from by the distance, we cannot able to see the nodules all over the body region. When you go near the animal and palpate, you can able to appreciate the skin subcutaneous swellings with nodules are noticed. So I have seen many number of cases. From the distance, the animal looks normal. When you go and palpate near the neck region, when we palpate, you will be feeling a small subcutaneous swelling here and there. That is also a case of lumpy skin disease. So here, cutaneous lesions all over the body region with the limb edema. The distribution of the nodular lesions all over the body. So we can able to appreciate the nodular lesions in all the forelimbs and hind limbs, and because of this, the lymph node enlargement in the prefemoral and prescapular limb edema will be noticed. Sometimes we may be getting edema in the ventral portion. So recently caught animal, the udder edema will be there. That leads to the normal physiological edema we can notice. Irrespective of that, sometimes we may be coming across only ventral edema alone. So you have to differentiate it from lumpy skin disease. We are getting many number of cases as the ventral edema and nodules with the swelling. And this is the LSD in cough, cutaneous lesions all over the body region. When the animal is very much debilitated, severity will be more. So lacrimation and the lesions distributed on the nostril, muzzle, and around the eyes. So you can able to appreciate the nodules around the eyes. So it's very severely affected in cough. So distribution of lesions around the muzzle, oral cavity, lesions in the muzzle, and sometimes you may be getting the lesions in the udder also. So like nodules all over the teeth. These are also lumpy skin disease. Some cases it may be getting contaminated with maggot, and we have to manage the treatment for maggot wound. So you can able to appreciate the lesions in the nostril, and you can able to see the swelling of the limb. The right hind limb is swollen. So if the lesions are obvious, so we can say lumpy skin disease. Otherwise, the differential diagnosis without any skin lesions, limb edema is alone there. We have to think about snake envenomation. First, when some cases were presented, I got confused what it could be. So naturally, we used to go for differential diagnosis with the snake envenomation. There is no skin lesions, only the history. The animal is having forelimb edema. Only one limb is having edema, or hind limb edema is there. So you think about snake envenomation. Any viper bite, you go for 20 minutes whole blood clotting time. If it is not clotted, it is a case of snake inflammation. If it is clotted in 20 minutes, you think about the other causes. Now the seasonal includes lumpy skin disease. This is a necrotic skin plugs, and these are the healing skin lesions. So skin lesions can be managed very much with any external application with antibiotic ointment or any herbal treatment remedies for 1 or 2 weeks, and in many number of cases complete healing was noticed very successfully. This is a ventral edema. In some few cases, I got feedback from my friends and from my students who are practicing a large animal. They used to say this type of lesions are sometimes noticed. For example, the animals which are affected from lumpy skin disease, after the affection of lumpy skin disease, they are not elevating the tail while defecation. So as it having tail paralysis. So animal defecate without lifting the tail, and also urinating without lifting the tail. Some few cases are being noticed in the field conditions. Some cases it will get contaminated with a maggot wound, and you have to treat it accordingly. This is the generalized skin nodules noticed all over the body region. This is LSD in cough, complete generalized skin lesions all over the body region. This is a ventral edema. So milk is normal, everything is normal, no mastitis and all, but edema is alone noticed. This is also lumpy skin disease. Brisket edema. The edema is mainly due to lymphadenopathy. Here, lymph node enlargement and lymphedema is noticed. So the formula itself will be telling that appreciable edema is noticed in the brisket or ventral area. So bulls may become permanently infertile. Affected bulls, they become permanently infertile. Pregnant cows may sometimes abort. Okay, and you have to regarding the diagnosis. You can do by the isolation, virus isolation. The samples can be collected, and you have to send it to the high security, the animal disease laboratory, which is in the Bhopal. And other diagnostic thing is the skin biopsy. I'll tell you how to differentiate these things. This is a golden standard test. Is the serological test is the virus neutralization is the golden standard test which has been appreciable. And one of the thing is that the skin biopsy. As a veterinarian, we are practicing in the field condition. You can go for the skin biopsy. So appreciate the lesion. Mostly select the lesions. You apply the lignocaine spray or lignocaine spray over that area where you are going to get the sample, and you can take the skin biopsy from the nodule, from the skin nodules, not from the other places. You get the skin nodules, and you can get it. And this type of intracytoplasmic inclusion bodies are the classical finding of LSD. So this can be appreciable in the field conditions. Okay, intracytoplasmic inclusion bodies are the classical finding in LSD, and you have to differentiate from the other conditions. LSD should be differentiated from other conditions like bovine herpes viral infection, bovine papillary stomatitis, pseudococcopox, and the other conditions as we discussed like dermatophylosis and other conditions. See here in pseudo lumpy skin is called as bovine herpes virus infection or bovine herpes mammillatis is always called as pseudo lumpy skin disease. Here the superficial, the lesions are very much superficial. Okay, and it's not as a nodules. The lesions are very much superficial, and there is no skin nodules are in this pseudo lumpy skin disease. So that you can differentiate very easily. And this is urticaria. Any sudden onset in the superficial skin lesion, sudden onset like a wheel-like structures noticed all over the body region, you differentiate from urticaria or any insect bite, fly bites, like as already I have explained in the previous pictures. And cowpox and pseudococcopox, they are pertaining only to the adherent teeth, not in the other body conditions. So you can differentiate very easily. And dermatophylosis, as we discussed in the morning, I mean the earliest slides, and you can appreciate the lesions in the forelimb or the hind limb in the petalec region, and then it will distribution is slow, and there is no skin nodules in dermatophylosis. And demodicosis, you can very much appreciate a small nodular like lesions appreciable. And bovine papillary stomatitis is pertaining only to the muscle region. And onchocercosis, as we already discussed in the previous slides, the distribution of the lesions are only to the ventral region, ventral portion of the body or mid-ventral line of the body, you think about onchocercosis. So diagnosis of lumpy skin disease is very much easier by appreciating the clinical signs, is very obvious. So there is no specific treatment, as since it is a viral disease, there is no specific treatment available for the lumpy skin disease. But we have to establish our own line of treatment for treating the cases according to the clinical manifestations. Symptomatic treatment can be done. So normally we used to get very good result by using antibiotics like enrofloxacin, streptopenicillin or sulfonamides. A course should be followed. So many of the practices they used to ask what is the line of treatment. The line of treatment you have to select according to the intensity of the clinical case, clinical manifestation. You treat it accordingly, symptomatically. So streptopenicillin can be used, enrofloxacin can be used, sulfonamides can be used to avoid or prevent secondary bacterial infection. When the animal is having pneumonic signs and all, you can go for ceftiofur sodium 1 to 2 milligram per kg body weight. Anti-inflammatory like flunixin can be administered at the rate of 1.1 milligram per kg body weight. So you can administer. And if edema is present, like lymphedema or ventral edema or hind limb edema, brisket edema, you can go for use of diuretics like acetazolamide. Tablet is available. Acetazolamide you can give, and it is available as a trade name Diamox, DAA-MOX, Diamox 250 milligram tablet. 1 to 2 gram BAD can be used, or you can use furosemide can be used. And supportive treatment, which includes like supplementation of B complex, vitamin A, and even you can use levamisole 2.5 milligram per kg body weight as a supportive treatment. So it's depend upon the individual cases. And the external application with any antibiotic ointment can be applied, but economically it may not be feasible for large animal practice. So we used to advise for pasting neem leaves with the turmeric. You can apply all over the lesions, and it is having a very good effect. And also you can apply povidone spray. You can put a povidone liquid in a bottle and spray over the lesions. If it is having maggot, you treat it accordingly for maggot wound. So these are all the external applications so that you can manage well with economically in large animal practice. As I already told, this type of herbal treatment is very effective in treating the skin lesions within 2 weeks. So this is that plant Euphorbia hirta. In Tamil they used to call it as Amman Pachirisi. You can make it as a paste and add the combination with the turmeric and tulsi leaves and 2 or 3 pieces of garlic, and make it as a paste and apply over the skin lesions all over the body region. Excellent result will be noticed. The other line of treatment, other homeo treatment, alternative medicine remedies are also available, that you can get packed all these type of medicines in a single goblets, and you can use it 30 tablets 3 to 4 times a day. A very good effective treatment. Within 2 weeks you will get complete recovery. So this type of treatment, this is all treated with only alternative medicines like before treatment, and this is after treatment. For 3 to 5 days, you can use the antibiotic and anti-inflammatory and other symptomatic treatment to prevent any secondary bacterial. And for follow-up, you can go for any alternative or ethnoveterinary or herbal treatment, so that effective treatment management can be appreciable. See here, after treatment, the skin lesions completely subsided. This is also thanks to my student, Dr. Karthik, who has done so many documented many number of cases in the field conditions. We have worked many number of cases. So this is before treatment and this is after treatment. Very good, excellent results are noticed. And this also, limb edema is noticed, skin nodules are noticed. The lesions get subsided after treatment. So here skin nodules are noticed all over the body region, and after treating symptomatically, switch over to the herbal remedies. So very good effective treatment after treatment is noticed. The materials to be collected, whole blood can be collected, the serum can be collected, and the excellent materials are the swabs of the skin nodules. Skin nodules are the best samples which can be sent. The other samples are swabs of the ocular or nasal or oral material. Whole blood, serum, and skin nodules are mostly preferable materials, and you can send it to National Institute of High Security Animal Disease Laboratory, Bhopal. And skin nodules, you can take skin biopsy or skin, the scabs can be collected 4 to 5 numbers. So you can collect these caps, 4 or 5 numbers from the skin nodules, and mix it with the 4 to 5 ml of phosphate buffer saline with 1 or 2 ml of streptopenicillin, and you pack it in a airtight container and keep it in 4-degree temperature and send it for the laboratory. Blood samples also can be sent, and blood you have to collect it, and you have to collect at the 7 to 21 days post infection. So the best sample is skin nodules. So prevention, restriction of the movement, mainly the restriction of the movement and the removal of the infected animal and keep it in an isolated place so that we can prevent the other animals affecting from the in a farm. So when a farm, suppose you are having 100 animals, 1 or 2 animals get infected, you isolate the animal to somewhere and go for the another prophylactic things. So regarding the prophylaxis, means vaccination, there is homologous vaccine and heterologous vaccine. 2 types of vaccines are available. Homologous vaccine means it's a lumpy skin disease vaccine. It's a live attenuated vaccine. It's not available nowadays in India, and it is available abroad. And the heterologous vaccine means a sheeppox vaccine and goatpox vaccine. It's a live attenuated vaccine that you can use anything you can use. Either you can use the sheeppox or goatpox. Many veterinarians, they used to ask whether they can use a goatpox or sheeppox. Any you can prefer. Whichever is available easily, you can prefer. So goatpox is usually advisable, and they are getting and they are giving good results. And the sheeppox is easily available. And we have given many number of feedback from the veterinarians. They have given sheeppox vaccine and a farm, and all the vaccinated animals, they didn't get infected. So whichever is available easily, that you can use. Either sheeppox or goatpox vaccine can be used for prophylaxis. So with this, we conclude this session regarding the common skin disorders in bovines. It's only a small area we have covered, and that too just for awareness, included a superficial thing. Superficial we have discussed, and in the coming learning sessions we can go in deep regarding each and every conditions, so that it will be very much useful for our practice. Thank you very much.